So I'm Dr. Lama Sharara. I'm Director General of the ARCAD Foundation. I'm a doctor in immunology and genetic engineering, and also a doctor in medical ethics, right to health and public health. I'm the CEO of the foundation, and I'm extremely honored to be interviewed by Pancreatic Cancer to present the ARCAD Foundation. ARCAD Foundation is a French research and patient advocate nonprofit charity founded in 2006. It works on different levels, nationally and internationally, to raise awareness, provide education, and advocate for the prevention, treatment, and cure of gastrointestinal cancers. The organization was granted the legal status of publicly recognized foundation by the French government in 2006. It is, as for today, the only French organization exclusively dedicated to digestive cancers. It was created by its chairman, Professor Emery de Gramont, the French world-renowned oncologist. I would like to talk to you a bit about the three main objectives of our organization. At ARCAD Foundation, we have three objectives. First, to make the public and health workers sensitive to the need for prevention and early screening for digestive cancers. Second is to promote the improvement of patient care, patient advocacy, and clinical research in the field of digestive cancers. And third, to provide better information and support to patients suffering from digestive cancers. Our philosophy, priorities, and action. We believe at ARCAD that the patient should be allowed and expected to participate in the decision-making process regarding his treatment, and whenever possible, efforts should be made to encourage the patient to participate in clinical trials. Our current priorities are to help the patients increase their chance for a successful treatment, to help patients find their way to information that allows them to have a clear choice of therapeutic options. We are advocating that each individual patient has access to the best treatment available. We give support to patients and to their families throughout and following the treatment. We want to be an active patient advocacy representative to ensure patients' rights. I would briefly summarize what we have been doing till now, and especially in 2020-2021. We are promoting and supporting clinical research. So we fund these clinical research in order to improve patient care. We finance innovative programs and multi-center research projects on international levels. For example, in 2020-2021, ARCAD Foundation has funded 17 innovative clinical research projects dealing with colon cancer, stomach cancer, pancreatic cancer, liver cancer, neuroendocrine tumors, biliary tract cancers, and some projects also for improving quality of life. We also conduct in full independence informational campaigns for the public and for the cancer patient population. We initiate the coordination of innovative programs associating public and private partners active in the field of digestive cancer research. We support large-scale screening for digestive cancers and make the public and the medical profession sensitive to the importance of prevention in reducing the impact of these diseases. In 2020-2021, for the screening, prevention, and awareness-raising access, ARCAD Foundation has dedicated 7 programs, among which Colon Days, which is a hepatogastroenterologist, in which, and during these days, the gastroenterologists have been involved for the past 10 years during Blue March in a major annual free prevention campaign for the general public on colorectal cancer screening. ARCAD is a major partner in this campaign. So we come again to Blue March, which is the month dedicated to colon cancer screening. We participate actively in relaying in France the international campaigns on colorectal cancer screening, and we support many colon cancer screening events. Leading pancreatic cancer awareness on national level, ARCAD has been organizing since 2016 roundtables in many regions in France, aiming to draw up an inventory of the situation regarding the supply of care and the territorial inequalities from pancreatic cancer patients. ARCAD will fund in 2022 awareness raising on experimental project. So we're going to fund projects on a national level on awareness raising and in funding for experimental project on the pancreatic cancer care pathway at local and regional levels. And last but not least, we are setting lobbying actions and parliamentary forums in France and via the European Commission to raise political awareness on GI cancers. Our foundation was a pioneer in setting a group of national experts on pancreatic cancer in 2016. These experts jointly reflect on how to raise awareness on this pathology among medical teams and among the public with the aim to write recommendations to be submitted to the policymakers and authorities. It happens that in the same year, 2016, Pancreatic Cancer Europe was officially established as an association, and thus ARCAD Foundation contacted PCE to work and reflect together on our common objectives. So we are working with PCE since it officially became an association. Our organization is proud to be a member of PCE because we share the same objectives on awareness raising, on education and advocacy. It's also very much in line with our foundation's desire to develop partnerships to support and strengthen research at an international level, and above all, which is a priority for ARCAD Foundation, to defend the interest of patients to have access to the best possible care. At ARCAD Foundation, we consider PCE as a strong and valuable partner, a partner able to represent and defend the interest of patients from any country and to bring their voice at the European level to authorities, decision makers, and stakeholders. What ARCAD can contribute to PCE? I think ARCAD Foundation can contribute to PCE in many levels. As a member of PCE, ARCAD can conduct a collective reflection on how to increase funds dedicated to basic and clinical research on pancreatic cancer and to lobby to get these funds, which are urgently needed. ARCAD can help to improve the early diagnosis of this cancer by relaying the campaign, by making awareness campaign for the medical and GI, for the medical care in general, and especially for the medical doctors which are in first line to receive patients. We believe that we can improve the care of patients by setting all together centers of expertise on pancreatic cancers. We advocate for an improvement in the standards of care for patients with the help of PCE. We also believe that we can strengthen the initial and ongoing training of doctors to enable rapid diagnosis. We can help to set up shared European registries on these diseases, which as of today are exist very shyly. We can help to raise awareness on the causes and the symptoms of pancreatic cancer among health professionals and among the public. And we can set effective and relevant awareness campaign that will be relayed in all European countries. In summary, we at ARCAD Foundation, we believe and we are convinced that together we are stronger to carry out our common missions. We are sharing our thoughts on these campaigns as I'm part of PCE. So we're having, we had a few sessions of workshops in which I'm part of the communication workshop. We are thinking together with all the countries involved in PCE on how to build a very strong awareness campaign on pancreatic cancer. And our mission as representative of France is to relay these campaigns on the national level. So we are part of this reflection from the beginning, and we're very honored to think together to make really a great campaign, and so people can be aware of the symptoms of the procedure, where to help them get the exact information and where to go to experts to be diagnosed, the early diagnosis. And also what we are really struggling for is to get funds to do fundamental research as to set early biomarkers for detection of pancreatic cancer. We really are try to lobby for that, either on the European level and on a national level. I think this is extremely important.